So here we'll talk about clavipectoral fascia under three subheadings: the introduction, its course, and the structures piercing it. So in the first point, it is a modification of the investing layer of deep cervical fascia, and it is present anteriorly to the axilla. For this, you need to see this image. So see, this is the axilla, right? And this fascia, it is present anteriorly to the axilla. So in the course, you have to remember 4 points. First we'll see this image and then we'll read that whatever is written there. So in this image, see here, this is the clavicle. This is the clavicle, right? So under the clavicle you have the subclavius muscle. This is the subclavius muscle, and so this fascia is splitting to enclose the subclavius muscle, and then it runs downwards and splits again to enclose pectoralis minor, and then it is continuing as a suspensory ligament. This is the suspensory ligament. So we have seen 2 points here. First thing, it is splitting to enclose the subclavius muscle and the pectoralis minor. This is the first point. And the second point is it is continuing as the suspensory ligament. This is the suspensory ligament. Okay, so we have covered 2 points. The other points are, see, after enclosing this subclavius and the pectoralis minor muscle, after enclosing it, this fascia, so this is the clavipectoral fascia. The one which I drawn in red color is the clavipectoral fascia. And suppose, see this one, it is a pectoralis major muscle. So under the pectoralis major you have the pectoralis minor muscle too. So the fascia covering this pectoralis major muscle, it's present here. So this red color clavipectoral fascia, it is merging with the pectoralis major muscle fascia. So that is the third point. And the fourth point is, see, this is the clavicle, right? So we have seen the clavicle here. This is the clavicle, and covering the clavicle you have clavicular fascia. Obviously, as the name suggests, you have the clavicular fascia here, and here you have the axillary fascia. You can see here, this is the axillary fascia. So this clavipectoral fascia, which you see here, is extending from clavicular fascia to the axillary fascia. So that is the fourth point. So it splits to enclose the subclavius and splits again to enclose the pectoralis minor. We have learned this. And it merges with the pectoralis major fascia. Yeah, we have also seen this. So it extends from the clavicular fascia. So I'm sorry, here it is the clavicular fascia. So clavicular fascia above to the axillary fascia below. We have also seen this. And it is continuous as a suspensory ligament below. Yes. And the attachment, okay, we'll see this here now. Clavicle. This is a clavicle. Correlate this both of the images, and this is a coracoid process of the scapula. See, this is a coracoid process of the scapula. So this is medial side and this is the lateral side. We know this, right? It's clear. So this is the clavicle, coracoid process, medial side, lateral side. This. So suppose this is a rib, and here you have this costal cartilage. So here you have the another rib. Suppose you have the another rib here, right? And you have the same costal cartilage here also. So in between two costal cartilage you have some membrane covering it, which is called intercostal membrane. In between two costal cartilage, so intercostal membrane, as the name suggests. So you have the subtypes like external intercostal membrane, internal intercostal membrane, and innermost intercostal membrane, which you will learn in the thorax topic. So the outer layer is the external intercostal membrane. This is the external intercostal membrane which I have talked about here. This is the external intercostal membrane present between the costal cartilages. So medially, this clavipectoral fascia, this is the medial side, right? Medially it is attaching to the external intercostal membrane, and laterally this is the lateral side. So laterally it is attaching to the coracoid process. So see, laterally it is attaching to the coracoid process, and medially it is attaching to the intercostal membrane. And now the important part, structures piercing the clavipectoral fascia. So now coming to the important part, the structures piercing clavipectoral fascia. This is a mnemonic. You're going to split this clavipectoral word this way. First you split this word this way, okay? Clavipec, and then the total fascia. Okay, whatever. So clavipectoral fascia. So the C stands for cephalic vein. So LA stands for lateral. PEC stands for pectoral nerve. And once you split here, and so here it's this THOR, it stands for thoracoacromion artery, and this L stands for lymphatics. So clavipectoral fascia, you're going to remember the structures piercing, which are cephalic vein, lateral pectoral nerve, thoracoacromion artery, lymphatics. So this is about clavipectoral fascia.